Republican Senator John Barrasso of Wyoming, back home in his home state, also a doctor. And, sir, thank you for coming back here. What is your read on this blue state, red state definition process? How do you see it, Senator?
Yeah, well, I see it in Wyoming, which is clearly a red state. We are open. People are out, but they're socially distancing. They're doing it responsibly. We had several Memorial Day services yesterday, very respectful, but people were out and doing what you would expect them to do. Businesses are open. People are engaged again. People are getting back to work. That's what we need to do for the whole country. Bill, I've seen this report about, was it Illinois and California, New York, New Jersey? That's about a third of the economy of the country. By being locked down, shut down for so long, even though statewide, there are lots of places that ought to be open in those states. And one size doesn't fit all. Regrettably, that's what those states are doing, which is going to slow down the opportunity for the country to move ahead as quickly as I think we will be doing once we get to this rebound.
Senator, the suggestion is that it's being done with intent. Do you believe that?
Well, they do seem to be the states that are asking the most of the federal government. We want to shut down, and they want more money from Washington. You know, the people in the West, the independent, self-reliant, individual people that we are in Wyoming, we want to get back to work. And it is just a concern when you see these blue states that continue to ask for bailouts, not just what's going on now as a result of coronavirus, but due to mismanagement over decades. The American people are not going to stand for that. We need to get back to work as a nation. We need to do it smartly, and we need to do it safely. We need to do it soon, and I'm ready to go, and so is Wyoming today.
Senator, on that point, are Republicans in the Senate willing to write it into language that if you do another phase, a phase 4, that none of it can be used for pension funds or bailout money for previous debts prior to 2020?
Well, a couple of things. If there's a next fund and there's likely to be another bill is number one, let's give the states more flexibility with the $150 billion that they've already been given so that they can use it in ways that work best for them in the state. But certainly nothing more for these pent-up demands that they've had and pension funds that have been inadequately funded for years. We also, if we do another bill, need to make sure that there's liability reform in there so that healthcare workers, small businesses, the mom and pop shops all around the country don't have to live in fear of a lawsuit for if someone happens to develop coronavirus, for either shopping there or going to that doctor or nurse or facility. And we know right now that lawyers all across the country are advertising, saying, if you had coronavirus, give us a call this 800 number. We are the coronavirus litigation team. We'll find somebody to sue. Bill, that's not going to help us get this country back open and moving and our economy strong and healthy and growing and vibrant again.
You write at foxnews.com, coronavirus collateral damage. This is your piece now. Here's why we must open smartly, safely, and soon. The conclusion line is this. The point is clear. Keeping states shut down will wreak havoc on the health of our society. As a physician, what do you mean by that, the health of our society, Senator?
Well, 600 doctors wrote to President Trump last week about this very issue. We cannot let the cure be worse than the disease. And as a result of the shutdowns, a lot of essential medical services have not been done. Other than coronavirus, hospitals essentially have shut down elective procedures, which can include cardiac stress tests, cancer exams, mammographies, all of these sorts of things. Plus, there has been a dramatic impact on the mental health of Americans. I talked to the president about this last Tuesday when we had the lunch, and he is well aware of the need to make sure we get the country open for the general health of the American people. Suicide is up in California, the Bay Area. One
Senator.
hospital reports 4 times as many suicide attempts in the last 4 weeks than they had all last year.
Senator, it's a very important topic. Thank you for sharing. I'm sorry the computer's going to cut us off. Come back soon. Back in a moment here.